I always say, or I quite often say, is follow the money. So, how much of this is being driven by large institutions to hire nurse practitioners instead of physicians?
Of course, this wasn't the whole idea of having NPs and PAs. Like I mentioned, the professions were started by physicians. The idea was, how can we get more primary health care to underserved patients? That was the whole concept of this profession. Let's train them, let's give them a little extra training, and let's send them out to these areas that really need care, and let's have them do the things that are within their scope. But then we start to see some dollar signs. And I think, first of all, the government invested very heavily in these specialties. The US government gave $100 million to train nurse practitioners by the year 1981. In 1977, they passed the Rural Health Care Clinic Act that mandated that all rural clinics that receive federal funding had to staff with at least 50% nurse practitioners and physician assistants. And I think part of this was this idea that would generate more, that would bring more people to the area. But actually, what it's done is it's limited physicians being able to work in these types of environments. And then, of course, we also had some private companies that have had a very strong interest in nurse practitioners. In our research, we discovered that the Robert Wood Johnson Foundation, which is the charitable foundation of Johnson and Johnson, one of the largest manufacturers of healthcare products and pharmaceuticals in the world, has invested millions and millions and millions of dollars into training nurse practitioners and in increasing their scope. They gave money to create this report called the Future of Nursing Report, which specifically called for nurse practitioners to become, quote, full partners with physicians. So the question is, well, why would Robert Wood Johnson have so much
Yeah.
interest in nurse practitioners? Well, I don't know. I mean, it's possible that it's because they sell a lot of pharmaceuticals, and we know that nurse practitioners and PAs prescribe a lot more pharmaceuticals, including, unfortunately, opioid medications. Janssen, which is a subsidiary of Johnson and Johnson, is a manufacturer of opioid medications. And of course, all of these minute clinics, by the way, CVS Caremark has a very close relationship with Robert Wood Johnson, and all of their minute clinics, these urgent cares, are staffed by nurse practitioners who then prescribe drugs that they fill at the very same CVS. So I'm not saying that this is being done intentionally, but I do notice that there is a correlation there, and there really should be some question marks being raised as far as whether this is really safe and good practice or whether there's financial incentive in it.